Okay, we're back. It's Ramey, I'm the man in the middle. So let's talk about the arguments for universal health care. So the supporters of government-sponsored universal health care usually focus on four main points: uh, access, cost control, financial protection, and public health. First of all, universal access. Supporters argue that health care should not depend on your employer, your income, your overall health history. Uh, Everyone should have coverage. It eliminates gaps that leave millions uninsured currently. Second, lower overall cost. The American healthcare system is extraordinarily complex. It's narrowly complex. Hospitals and doctors deal with dozens of insurance companies, each with different rules, billing systems, and approval processes. This administrative complexity costs enormous amounts of money. Private insurers often spend 12 to 18% of their total revenue on overhead. Public programs like Medicare operate closer to 2 or 3%. Some estimates suggest that the universal system could save hundreds of billions of dollars annually by reducing administrative waste and negotiating lower prices for drugs and services. Just on a side note, most countries do negotiate the rates for prescriptions, for example, and also a large percent of them uh, negotiate or provide what rates you can charge for certain procedures. Third, financial protection for families. Medical debt is a serious issue in the United States. Medical bills contribute to hundreds of thousands of bankruptcies a year, and tens of millions of Americans carry medical debt. Supporters argue the universal coverage would eliminate many of the costs that families face today, including premiums, deductibles, and surprise billing. The fourth is better health outcomes. When people have consistent access to doctors, they're more likely to receive preventive care, treat problems earlier. Early treatment often reduces long-term costs and improves health outcomes. Supporters argue that universal health coverage could lead to longer life expectancy, lower infant mortality, and either a healthier population overall. Many physicians support this and some form of universal system because it could simplify billing, reduce administrative burden, and currently takes away from their patient care. Supporters summarize their case in this way: America already spends the money. The problem is the system spends it inefficiently and unevenly. Now, next, we're going to cover the downsides of the argument against universal health care.